Hey guys, what's up? My name is Moshe Levin and I'm a registered nurse in Israel. And today we're going to be talking about baselines. But first, don't forget to like, comment, and subscribe to this channel. And of course, don't forget to click that notifications bell so that you get notified every time we make a new video. So first and foremost, what are baselines? Baselines are assessments that are used in many different fields in order to determine a specific status that we can look back upon and understand whether what we did was beneficial or not beneficial, or whether we accomplished something with what we did or we haven't been able to accomplish anything, or maybe we even made something worse. In the medical field, it's used very often by doctors and nurses, so on and so forth, to assess a patient on whether our treatment plan that we built for that patient is making the patient better, making the patient worse, completely not affecting the patient, so on and so forth. It is very important so that we as caregivers can change and tweak our treatment plan so that is the best and the most equipped to treat our patients. So of course, doctors and nurses, we generally assess different things and we focus on different things when assessing a patient, whether for baseline or whether for treatment plan, so on and so forth. How do we set a baseline? Setting a baseline for a patient is done generally at admission or at the starting point of a treatment that is done in a clinic or in home care. The baseline or the assessment that is done at hospitalization is a very thorough and encompassing baseline that covers many different aspects, as many aspects as we can. Nowadays, it's generally computerized and we have a built form in the computer that we don't really have to think much about what we are assessing the patient. The computer will actually tell us what we need to assess the patient on. And if we need, we can add certain aspects to it as needed. So generally what we will assess as nurses, we will assess vital signs. This is blood pressure, pulse, the oxygen saturation of a patient's blood, pain, so on and so forth. We will also assess skin integrity. This will mean wounds that the patient might have. If the patient had some surgery, what is the status of their surgical wound? If they have any form of rash, allergic reaction, so on and so forth. This will help us understand whether the patient is progressing or regressing, so on and so forth. We will also assess the patient's functionality. This is something that we very heavily depend on when creating a treatment plan for patients that need help in day-to-day functions. We will also assess a patient's awareness to their surroundings, awareness to their family, whether they recognize their family, don't recognize their family, so on and so forth. And of course, consciousness is something that's very important, and it will help us understand whether a patient is deteriorating from a conscious level or is getting better from a conscious level, so on and so forth. Using a baseline. So in the nursing field, we have what's called the nursing process. It's a form of diagnosis and creating a treatment plan for the patient. Whether it's for lowering blood pressure or preventing wounds or treating a wound or giving the patient IV fluid so that they feel better. For everything that we do, we create a treatment plan that will help the patient become better. And part of that treatment plan is also building a proper assessment that will help us understand what the status of the patient is and how well the patient is responding to our treatment plan. Without a baseline, we would not be able to do this assessment. We use the baseline in order to determine whether our treatment plan is actually affecting the patient and whether that effect is the desired effect or a different effect or an undesired effect or even possibly making the patient worse. Without this, we wouldn't be able to tweak our treatment plan to really fit our patient and to really be as good as possible for the patient. This is something that we do on a daily basis. Most nurses that work for more than a few months, they do it automatically. They do it in their head as they're giving the patient the treatment. As they're writing up the treatment, they're already thinking about how they're going to assess that treatment, so on and so forth. It is something that we do automatically. We don't even think about it. Why do we need a baseline? What is so important about a baseline? Of course, we know that if we don't have the baseline, then we can't compare our treatment plan to what the patient was beforehand. But it's a lot more than just that. Sometimes our treatment plan could be effective in the aspect that we want it to be effective, but at the same time, it could be damaging in some form of other aspect. For example, if a patient is getting IV fluids, whether it's for dehydration, low blood pressure, so on and so forth. Of course, we can assess the blood pressure, we can assess the patient's hydration based on blood analysis, based on other forms of assessment that we learn. We can assess the patient whether their dehydration is getting better or regressing, so on and so forth. But if, for example, this patient has heart failure, giving them IV fluids, especially in large amounts, could cause them to have a worsening in their heart failure. It could cause them to have more pressure on their heart because we are giving them more fluids. And this is something that could very, very heavily damage our patients. And we need to pay attention to that. If we don't create a baseline of the patient's heart failure and we don't have an understanding of what the patient's baseline is from their medical situation, from their heart failure, then we won't be able to understand if these IV fluids are damaging the patient or not. And even if we did an assessment on, let's say, the dehydration, if we don't have a prior assessment to their heart failure, no matter how many assessments we would do right now, we wouldn't be able to get an understanding of how much this IV fluid is damaging to our patient. This is why creating an all-encompassing and as accurate as possible of a baseline prior to starting any form of treatment is super important, because we can never know what this patient might have in underlying diseases or in their background or anything else. It could be the patient doesn't even remember, and then it pops up, and now we have absolutely no idea whether this patient right now is worse, better, so on and so forth. Therefore, setting a baseline when we start a treatment as accurate as possible and as wide as possible is very, very, very important. Thanks a lot for listening, and I hope you guys enjoyed this video. Next week, we'll have another video for you guys. And don't forget to like, comment, and subscribe to our channel.